Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. And I want to provide a quick answer to an important question that came up this week. And that is, why are more people dying from COVID-19 in Northeast Tennessee than in the rest of the state? Why do people ask this? Well, because the death rate for COVID-19 in our region is about 66.7 deaths per 100,000. The rest of the state overall is 57.4, so we're about 16% higher. So why are we dying more rapidly than others? Well, obviously, it could be bad health care. It could be lack of access to health care. But I think it's actually a pretty simple answer. If you look at the factors that are associated with death from COVID-19, all of these are worse in rural areas than in urban areas. But the one I want to focus on is the last one. Because if you look at the spike in deaths that occurred in the United States in March and April of this year, you can see that overwhelmingly it was in folks 85 and older, 75 to 84, 65 and older. The older folks are, the more likely they were to die from COVID-19. So let's look at the average age of the 8 counties in Northeast Tennessee. If you take a weighted average of all of them, it's about 43 and a half. Now let's look at the 8 most populous counties of Tennessee. These make up about half the population of the state, about 3.5 million people. And the average age is almost 8 years less. The average age nationwide is 37.9, and in Tennessee is 38.8. So you can see our region is quite a bit older than Tennessee overall, than the U.S. and the 8 most populous counties in the state. Now, obviously, just age isn't the matter, right? It's also how many people are over 65. So you look at the percent of our population over the age of 65, and again, the weighted average is just over 1 in 5 people. For the 8 most populous counties of Tennessee, it's about 1 in 8, considerably less. In the U.S. overall, it's 16%, about 1 in 6, and the same in Tennessee. So again, we are older, and we have a greater percent of our population over the age of 65, the highest risk group for COVID-19 deaths. And not surprisingly, our death rate in this region, as I've already told you, the weighted average is 66.7. The 8 most populous counties, the rate is quite a bit lower. Nationwide at 76.3. So we're about midway between Tennessee and the rest of the U.S. And when you think about the impact of COVID-19 on the rest of the United States, you begin to realize how important age is in our region. So yes, there certainly are other factors. We know our heart disease rate and lung rate and other health issues are also important in rural Tennessee and in rural America. But the one I think is contributing most is age, contributing to COVID-19 deaths. If you have any thoughts or comments on this, or you have any questions you'd like me to address, please let me know. I look forward to hearing from you. Thank you very much.